Welcome to Pep Talks, the Patient Engagement Podcast, brought to you by the Alberta Spore Support Unit Patient Engagement Team. I'm your host, Sandra Zielinski. Join us for insightful discussions with patient, family, and community research partners, academic researchers, clinicians, policymakers, and other stakeholders on the topic of partnerships in patient-oriented research and patient engagement in health research and health care. In episode 4 of the PACER series, we talk about the complexities of congenital cytomegalovirus, or cCMV, a common virus that can affect 1 in 200 unborn children during pregnancy. Join us as we discuss a parent-led, peer-to-peer patient and community engagement research study about the impact of cCMV on newborns, including potential lifelong health and developmental challenges such as hearing loss, visual impairments, and developmental delays. We will discuss the importance of early diagnosis, prevention strategies, and the controversial topic of universal newborn screening for cCMV. Our guests, PACER graduates, parents with lived experiences, and a clinician-researcher talk about this critical issue in maternal and child health. The PACER program works towards transforming the role of patients in health system research, practice planning, and policy with the aim to create more sustainable and effective person-centered care. To learn more about the PACER program, you can go to episode 1 of the PACER series with Dr. Maria Santana, the scientific director, and Ingrid Nielsen, the instructor for the PACER program. I'm excited to introduce guest speakers Laija Beaulieu, Caroline Leroux, Lisa Robinson, Marcia Bruce, and Dr. Eliana Castillo. Laija is joining us from Thunder Bay, Ontario. She is a recent graduate of the PACER program and will be starting her PhD in health sciences this coming fall. Laija's academic career is inspired by her son, who is affected by cCMV and has profound deafness bilaterally. Caroline Leroux is a recent graduate of the PACER program from Montreal, Quebec. She is an osteopath and worked with her clientele for more than 10 years. 2 years ago, she left her practice to be a stay-at-home mom, and she joined the PACER program to be part of the CMV team. Caroline's daughter, Jade, who is 5, was diagnosed with cCMV at birth and has severe hearing loss with a cochlear implant and hearing aid. Lisa Robinson is a speech-language pathologist working in early education. Since experiencing her own journey with cCMV, she has become an advocate for greater awareness, prevention, detection, and management of cCMV. She is driven by the belief that every family deserves the knowledge and care that is needed to improve outcomes for each child. Marcia Bruce is the research program manager for the reproductive infectious disease team at the University of Calgary's Cummings School of Medicine. As a patient and community engagement researcher, she was excited to work with the CMV PACER team as their team support. Dr. Eliana Castillo is a physician who works with pregnant people experiencing medical problems or infections. Her research focuses on closing the gap between what we know helps mothers and babies live healthy lives and what actually happens in everyday clinical practice by partnering with patients to understand their journey during pregnancy. So welcome, everyone. So one thing that makes the PACER program unique is that patients, families, and communities often bring their direct lived experience and unique insights to the research that they are conducting. And so maybe I'll just turn it over to you, Laija, to maybe share some of your personal experience with CMV and how it has impacted your child's health and influenced your involvement in the PACER program.
Yeah, thank you. I want to say thank you for bringing us all here together. I feel really fortunate to be part of this and share my experience and kind of our experience through PACER as well, because it was such a wonderful thing I think that we all did together. So I live in Thunder Bay, Ontario, which is northern Ontario. And so for people who aren't aware, it covers about 80% of Ontario's landmass, but it's only home to about 6% of the total population of Ontario. So Thunder Bay is a city of about 100,000 people. It's considered a hub for almost all of northwestern Ontario, but it's considered remote. So in terms of healthcare, it is difficult. It's hard to find family doctors. There's lots of wait lists and referrals to go down to Southern Ontario, which is about a 14-hour drive for us here up north. And so I had my son 12 years ago, about 12 and a half years ago now. And he was born healthy and average, and we had no concerns. And I started to notice that he wasn't really hitting his motor skills. Like he wasn't starting to roll over and he wasn't able to hold his head up. And that was something that was a little concerning. But they said every child, kind of goes at different ages, so don't be too worried about it. But then I noticed when he was about 8 months old, I was cooking in the kitchen and I had him on his blanket and with his toys, and he was right underneath the smoke alarm. And the smoke alarm went off when I was cooking, and it scared me, and it didn't affect him at all. He was still playing. And I'll never forget this moment. I sat back on the sink and I just kind of watched him with the smoke alarm going off, thinking, okay, something's very wrong here and I don't know what to do. So it took us quite a while to get into a childhood audiologist in our area because, again, they serve a lot of the surrounding area. The wait list originally was over a year long, but with some dedicated calling and I think annoyance on my part and advocacy, they did get us in within I think a couple months, which was very fortunate. They didn't have to do that, but they did. So, I'm grateful for that. And we started our journey finding out that he was profoundly deaf bilaterally, so in both ears. And we did hearing aids. That didn't help. He did have some fluid in his ears. We got tubes. That didn't help. So we finally got referred to the Stick Kids Hospital in Toronto, what a lovely, wonderful place filled with lovely, dedicated, wonderful people. And there we found out that he was eligible for cochlear implants. So by the time he got that, he was just a little over 3 years old. So now my son is 12 and he does have delays with speech and language because he didn't get implanted till later on in life. And he does have still a little bit of motor kind of balance issues, but he's starting to learn to grow out of those with some therapy and kind of stuff that we're doing at home. But, on the spectrum of what could be with cCMV, we are very fortunate that really the only things that we noticed that really impacted my son was the hearing loss, which we have cochlear implants and it does restore his hearing to pretty average levels, what can be anyway for a cochlear implant for artificial hearing. But so yeah, that's it. It was I think that for any parent, it's a very devastating diagnosis to get. I didn't actually get the call from the Sick Kids Hospital to know that it was cCMV that caused the hearing loss and the motor deficits and a little bit of brain abnormalities with his white matter until he was around 5 years old. And that really hit me hard. And there was no supports. I didn't feel anyways at that time. And I felt really alone and I had no one in my area that I knew that was going through this. And, family and friends can try to help, but quite different when it's something so specific like this. So it was really devastating for me. I really struggled with that for a long time. I still have my moments 12 years later where I still cry about it and struggle with it. But I thought, well, there's got to be something I can do. So I've, kind of found out that research is really important for making any type of social or structural change. So I went to university. I took my undergrad in psychology. I just finished a master's in social justice studies, and I'm going to be starting a PhD in health sciences in September. And my research focuses on the lived experiences of families who have children with cCMV living in a remote rural area, such as mine in Thunder Bay, and what they kind of want and need and what they feel like would help. And so what I found from my master's, I'm taking into my PhD, and I'm hoping to kind of do a little bit of grassroots efforts here in my area for families like us. And that's actually what led me to CMV Canada. I didn't know that CMV Canada was around until I kind of started going through my education at university. And I got in touch with them and I got the email about the PACER program, and it just seemed to fit really well with my my passion, I guess, for equity in health and healthcare, and obviously cCMV coming from a parental, lived experience perspective. And I don't know, it just kind of aligned right at the right time as I was doing my master's, and I'm really happy that I got to be part of it. So that's my and our story.
Thank you so much for sharing. It is inspiring as well to hear that you're pursuing your education in the area that, for obvious reasons, that you feel passionate about. So thanks for sharing your story. And Carolyn, would you like to share some of your personal journey with CMV?
Yes, I'm glad to. And thanks, Leia, for sharing your story again. So I was on the PACER program with Leia. So I'm a CMV parent. Um, so CMV cytomegalovirus is a virus that everybody can can have in a day-to-day life. So I was diagnosed when I was pregnant with my first one with CMV. So I was very lucky to be diagnosed with with that virus because I was my follow-up for pregnancy, I was doing it with a midwife, and it wasn't protocol to have a blood test to check if I was immune to infantile diseases because I'm an osteopath and I was working with clients, with clientele, with kids, with sick kids sometimes, and I didn't know at this point that it can be uh, that it can um, that it can expose me to CMV. So between the second and the third trimester, that's when I got very sick with a cold. I had two colds in a row with a stomach bug, and I told my midwife, is it possible for me to get a blood test just to get checked if everything is fine with my pregnancy? And everything was okay with the protocol. Normally, they are searching for other diseases that must be involved, but they said, "Oh, your viral load with CMV is very high for pregnancy, and we don't know if it's a first infection or a reinfection." So that's all the specificity of that virus. So, because of that, I got into a protocol where I was checked a little bit closer for the end of my pregnancy to see if, because there was 2% of chance that I would transmit it to my baby, and they said we're going to follow you with ultrasound to see if there's any concern about your fetus or your baby in your womb growth um, deficiency or some signs that your baby caught CMV when you were pregnant, and everything was fine. My pregnancy was fine. My baby looked healthy, and my husband and I didn't search that much on CMV because it was just 2% of chance. It's like Down syndrome. It's like all the other viruses. So we were like, let's wait till Jade is born. So now Jade is 5 years old, so had birth. She went through protocol of seeing if she was infected, and sure enough, she was very highly infected. So we were kind of lucky to know in advance that she had to get tested at birth. Um, so we ran a bunch of like it's my first. I had a complicated birth, and there was a lot of testing for my baby, my newborn, a lot of visits at the hospital. So I lived in Montreal, Quebec. So we were having accessibility maybe a little bit more than Leia at this point um, with Saint Justine, a very good pediatric uh, hospital in Montreal. So we were followed very well for all the signs of cCMV on my baby. And at 17-day old, we got the big diagnostic of my baby having cCMV, so congenital CMV. So she had calcification in her brain. She had earring testing and earring loss, a profound earring loss on both sides. And we were offered a treatment. So it's a treatment that is offered to babies that are diagnosed very early in age with CMV. So it's valganciclovir. So we were 6 months on a high, strong medication to make sure that, or to wish that the CMV infection um, wasn't gonna affect all those gross motor skills or hearing loss a little bit more, or all those side effects of having cCMV. And here it is. Here I am with my 5-year-old. So far it's just the hearing loss that she has. And we wish that it's gonna stay like that. We never know, because whenever you have the diagnostic of your child having cCMV, the doctors are the doctors knows what can be affected. Like, is your baby gonna eat? Is he gonna walk? Is he gonna talk? Is he gonna hear? Is he gonna see? And the first year of having a baby is like the milestone. You have to wait for the nervous system to be mature enough to be able to walk. So for the first year with my baby, it was kind of stressful because we didn't know if she was gonna go through those milestones as uh, by the book, by the book that we all know. Or so every time she was having a skill like walking on her floor, walking, we were so happy and lucky that she was able to do this, but the hearing was the most affected. So we were able to provide her a hearing aid at 3 months. 3.5 months, she has her hearing aid on the right side. And we, in Quebec, it's kind of a qualification for cochlear implants. So by the time she passes all the tests for the left side, she got her cochlear implant at 13 months. So she did a lot of speech therapy, and so far there's no delays because she was able to hear very young. So she's functioning very well. She speaks well, or we don't know the difference with other kids. But this was the biggest stress, for having your first pregnancy, your first baby, and you have a disabled child in a way. It was a couple of years of very stressful situation, a lot of appointments, a lot of medication, a lot of um, adaptation. And yeah, so, but now we, she's 5 years old and she is so resilient and she's so vicious in life, and she's very empowered with her hearing devices, and she grew up with them. So for her, it's, I don't want to say her normal, but it is her way of growing. And as parents, we were so stressed having to accept and live, and we wanted to know if we were able to manage and to be present and to be strong with her in her life. And so far, I think we are also very resilient and um, very strong as a family with everything that we went through. And just like preparing for that podcast, it kind of reminded us like all the challenges we went through. And we are such, like, having a disabled child, it's, you don't know how it is until you have one. So I I I give a lot of love and energy to all those families with living with disabilities in their environment. And CMV, like, it's just not a common word, a common virus. It's a common virus, but a lot of people doesn't know about CMV and cCMV and all the impacts that it can do on the baby, on families, and on on in the world. So that's what gave me the strength to be on that PACER program, and how to how to give and how to make a difference. Because I just want to say a little something that came to my mind, is that it took me 4 years, about 3 years, to have the energy to do something in the CMV community, like to communicate with CMV Canada, to be able to advocate a little bit more. And I met a couple of CMV parents and doctors and researchers at a conference in 2022. And that's how I learned about the PACER program. And at this time, I stopped my practice in osteopathy for my husband's work, so I had a lot of time. I don't have a lot of time, but I had an open schedule to add more CMV and implication or involvement for me to be able to do a difference. And I was able to find the way I wanted to spread the word, like with research and with partnering with CMV.
Sounds like you've learned a lot from your little girl growing up and her resilience and her, vibrancy for life. And so, yeah, it's very inspiring to hear from both of you. So thank you so much for sharing your stories.
Yeah, I just wanted to say as well, just like Caroline, I had no idea what CMV was or cCMV. And when I started to Google and search it, it was terrifying. And I had a lot of years, my son is 12, but I had a lot of years with the unknowns about, was he going to have a learning disability? Was he going to have any memory disabilities? And that doesn't really come out until as they age. So I just wanted to echo that sentiment that it was really overwhelming. Also, because I had no idea. I had no idea. And to know that I was the one that had the virus that passed it to my child was also very hard to kind of cope with. And I am usually not a shutting down type of person. I take things on head on, but it took me a while to even research further than what I absolutely needed to know because I didn't want to face that. It was really difficult. So I'm glad that I did. I'm glad that I dove in with my school and I have learned a lot about it. I felt freeing in that, but yeah, it was really overwhelming. I had no idea. And my son too, just like he's happy and he loves his ears, he calls them, and he loves to show people about them and educate people about them. And we've talked about my guilt about passing the virus to him, and he tells me that it's okay and that I couldn't help it. I'm a great mom. And so it's all these important discussions to have. And I think I'm going to try not to cry. I think that was also freeing in itself too. So this is a journey. I guess what I'm trying to say is it's a long journey. Like you had mentioned, Sandra, it's different for everyone, but there are these kind of commonalities, I think, for all of our stories in certain senses too, that build us together. And I'm happy that I reached out to CMV Canada and I'm doing this with school. And I feel, I met Lisa at a conference and Carolyn and Marcia and Dr. Castillo and all of these people who are behind you. And I don't feel so alone anymore. So I just wanted to put that out there too, that there is comfort in going out and kind of finding your team. I just love that part of all of this. I feel supported anyway, as much as I can.
Absolutely. And we do have Lisa here. If you want to say hi, you can say hi. She's just popped on.
Yeah, thanks, Sandra. I am actually, I'll just speak about why I'm in Calgary this week. We live in a more rural area, and I'm in Calgary for my daughter to attend a cerebral palsy kids camp. Every cCMV story is different. But I just want to echo what Laija just said, and I feel it every time we're able to connect, whether it's virtually or in person at some of these conferences, that for me, the silver lining of having a child with congenital CMV with really complex developmental differences and disabilities in our case has been just connecting to that community of parents and the professionals who come together to support this group of families are just incredible. And I think, my life would be very different without having that experience. And it's something I'm really thankful for. It's like, there's kind of a saying in CMV, we say, worst club, best people. Not a club you want to have to join, but once you're there, you're going to meet some of the best people that you'll ever encounter in your life. And it really does challenge us to learn and grow. And our kids are just so, so inspiring. The group of kids that we get to know and get to see and follow as they grow up. It's just the most inspiring group of kids and families. So for me, I think there's been a lot of positives along with the challenges. And I remember I'll never forget meeting Carolyn in Ottawa and Laija in Utah. And you make those lifelong connections because there's just something deeper than the surface when you have that shared experience. So thank you for highlighting that and for talking about cCMV.
Yeah, and thanks for hopping on and sharing a little bit about your story and background. All of you bring so much insight that you've learned, and that you can draw on to do the work that you are doing now and to help other people that may be facing this down the road. So I think this is a really good segue to loop in Dr. Eliana Castillo to talk a little bit more about why this research topic is crucial from your perspective, which you're going to bring a different perspective than people living directly with this.
Thank you, Sandra, and thank you to all of you, all of you in a way or other have given me the opportunity to join for parts of your journey, and that makes my life richer. Why this research? I think the why is because of the invisibility of CMV. So CMV is a virus and is a super, super common virus that everyone gets at some point in their life. And is one of these sneaky viruses that once you get it, it stays in your body, but you can get it again. And that's where the invisibility starts. The public doesn't know that there is this virus out there. And then the public includes, young people like Caroline or Lisa or Laija that were planning to get pregnant or got pregnant. They didn't know, they hadn't seen, they didn't know about this super common virus, and they didn't know how to protect themselves. The public don't know about it, don't see it. Pregnant people, dads, grandparents don't know about it. And also providers like me, when we are on the other side, we also don't know necessarily, because it's one of those things that is kind of a tiny little piece of a lecture in one of the many lectures in medical school or in nursing school or in physiotherapy school, right? In sciences in general. There are so many nuances about the viruses and how to get it and etc. But bottom line, a lot of providers, we don't necessarily know. And if we know, then we don't necessarily see how important it is that we have discussions with the Carolines and the Laijas and the Lisas of the world so they can make a choice about what they want or don't want to do during their pregnancy to prevent getting CMV infection. Caroline gave a beautiful example. Caroline was probably the 10 to 20% of moms who get CMV during pregnancy and can tell that something is wrong because Caroline felt like she had a virus, like a cold. Caroline's providers actually tested for this virus because these providers had midwives who are probably very in tune with these viruses in pregnancy. But Laija or Lisa were in the 80% of moms that don't feel anything. And they can still get the virus even for the first or the second time in their pregnancy. And then that brings me to what we mean by congenital CMV. So when a pregnant individual get the infection, this CMV virus infection in their pregnancies, then there is a chance they pass it on to their baby because this virus during the time or during the weeks that the virus is super active in your body, during those weeks, the virus is in the blood. And as we know, moms send their blood to the little one. There are some instances where the virus goes from mom to baby. It doesn't happen all the time. It depends when the infection happens. Very importantly, not all babies who get congenital CMV, meaning that they got the virus when they were inside their pregnant parent, not all of them will be what in our medical terms we call symptomatic, which again goes with the invisibility. The majority, actually 85 to 90% of babies who are born with congenital CMV infection, so they got it inside the womb, they are take-home babies, like Leia's baby. Those of us in the healthcare system who, work on testing babies for which there is treatment to either cure them from the illness or prevent them from getting consequences from the illness in this, or in the infection. If we would test babies at birth, then we would know who's that 1 in 200 baby who has the infection. And why is that important? Because even though as most babies who are born with infection are take-home babies, if I take a look at all babies who are born with infection, about 1 out of 5, so 25% of all those babies will have a serious health consequence from this infection. And this health consequence may not show at birth. It may show when they're 2 or when they're 3 years old. For example, Laija, something happened and she could tell that her 8-month-old couldn't hear. But sometimes something like that doesn't happen. So we have 2 and 3-year-olds that suddenly stop hearing and they cannot tell us, Mom, Dad, I cannot hear you. Even though there is actually a lot of science on medications like antivirals to try to put a break on the virus when babies get it. Even if we wouldn't have those medications, if we know that a baby like Leia's baby or Caroline's baby, if we know that actually the hearing loss is kicking in, with the hearing aids, those babies can go on to participate in the school, to learn to speak, to learn to read, to work on their communication skills, and the disability from CMV is preventable. This research matters because CMV is invisible for the public, is invisible as well to the school teachers and the speech language pathologists and the physiotherapists and all of those that actually are interacting day to day with those little ones who are born with CMV. So I am a doctor, and for 25 years I've worked with parents who are pregnant and they have a medical problem or they have an infection, and that's how I met Lisa. And I spent almost 15 years writing guidelines, which kind of on trying to share with my colleagues the best data that we have on doing things. And one of them, for example, was a guideline on CMV infection in pregnancy. In that guideline, we were in North America the first guideline to recommend providers talking CMV with pregnant parents and individuals. The one thing I learned writing guidelines is that guidelines don't go anywhere. If we as providers who write them and practice, and importantly, if patients and persons don't know about it, the revolution that needs to happen for CMV is not going to be fixed by providers or people who write guidelines, is actually on the people that is doing this work, on the persons and the patients who live with CMV. So in the last few years, I've learned about that there are methods to bring patients' voices in with lived experience. I'm not trained on those methods, but there is people who are. That's how this research came to be, because there is people who with lived experience that all of us, everyone, needs to hear from.
Do you want to talk a little bit about why you made the decision to support a PACER team, so patient and community engagement research team, to conduct PACER research, which is a specific qualitative research methodology, and a little bit maybe about your experience of what this has been like. And then we'll talk a little bit about the PACER study that Laija and Caroline co-conducted along with the rest of their team.
Sure. By sponsoring, I mean, there was, it meant pulling some funding for people with lived experience to get trained on, how to do this qualitative research. I was basically a bridge between the people I have had the honor to work with who have this lived experience and the people who have the funding to do it. That's how the sponsoring, came to happen. Throughout all the years that I've been working on CMV on one way or other, we always have heard from policymakers and the people that actually implement change in the healthcare system that maybe we shouldn't be testing babies about CMV because we would create unnecessary anxiety among parents. I know because they have told me, because the parents have told me that they want to know. So there is this big discrepancy between what parents say and what decision makers or people that make resource allocations think parents say, or how they want to protect or what they want to protect parents from. This nagging gap between what people feel, people with a lived experience feel, and what people think they think. This was nagging me for a long time, and I didn't know what to do about it except being angry until I met people like you, Sandra, who do patient-based research, and I realized that actually there were structured ways, maybe this is not the right thing to say, but accepted ways to maybe get the two sides to listen to each other.
It's definitely a different approach to research because obviously you could have worked with your academic research team and gone off and conducted research and done some interviews or focus groups. But I think in this type of research, as we speak about CMV and specifically parent-led research, there's a different dynamic that happens when this group of people come together to co-design the research to then also engage with other people with similar lived experiences and how those conversations go. So we'll talk a little bit more about that and hear from Caroline and Laija working together on this PACER research project. I'm just wondering, Laija or Caroline, if you would like to share a little bit about your PACER team and how you came together to co-design and conduct this CMV study.
So I can start. So I met those beautiful people like Marcia, Bruce, and Eliana. I think I crossed her, and Lisa in Ottawa 2 years ago. And they were talking about that program, and I didn't know how to do a difference in the CMV world, like how to spread the word and how to talk about my story, because talking about my story with people around me were not as strong. And when Marcia reached to me in the fall saying that there would be a PACER program for us to conduct qualitative research with other parents, CMV parents, and other amazing people to make a difference, I was like, of course, it's a very great idea. So for me, I was able to disconnect from the emotional part of it and be more in the data and more in the research. So it helped me to grieve, not to grieve because we're always grieving, but it helped me to be just more scientific about the fact. And I feel like bringing scientific facts when you talk about a subject that is emotional, it's much more powerful. So I met Laija and four other amazing women.
Yeah, no, I totally echo all of that. And it was really such a wonderful space, I think, for all of us to get together and have this commonality that we, have lived experience, like Carolyn and myself, with having a child with CCMV, but the four other lovely ladies with lived experience with having, children with health impacts and other family members who were impacted by health issues. And it was just a really great space. I feel really lucky that we all kind of got together and we all did this together. And it was really quite wonderful, because I think that with qualitative research, I think it gives power back to the individuals who have that lived experience, because really we are the experts. We are the ones who are going through this, and we want our voice to be heard. And oftentimes I find and I feel in research that's not really considered, especially in medical research. It tends to be, those who are on the kind of the medical practitioner side of it. So I think that was a big part for me too, where I felt that this was really meaningful work. And this is, like I had said about social and structural change, I don't think that our intent was to make social or structural change necessarily. Well, maybe with this project, I think that's the hope always. But I think that as we started going through it, we really started to, when we started collecting the data, we really started to find these kind of common key themes. And it was really interesting to I felt, anyways, I can't speak for Carolyn, but for myself, to try to take my experience out of it and listen to others and not be biased, because I know how I feel. And I know that I would have wanted my child to have been diagnosed at birth and got his cochlear implants earlier, so that his speech and language wouldn't be delayed. I mean, he's doing great. He's catching up, but he's 12 and there's still delays, especially with the school, right? So thought that was kind of great to sit back and try to take my experience out of it and hear what other parents' thoughts and feelings and perspectives were. And also it was interesting at the end of it that they really did align with myself and my experiences and my thoughts and perspectives too.
Yeah, I think you bring up a really good point too within the PACER program. And a part of that program is learning about implicit and explicit bias. This is a good segue into talking about your methods that you use for data collection and how you came to those decisions together as a team, and what you did to gather information from the participants that you worked with.
Yeah, absolutely. I think, before I forget, and first and foremost, it was really wonderful to have Marcia there to help guide us, because it's a lot to have 6 people doing it. In my school, a lot of it was just myself and doing my own education, but I really had such a wonderful time working with 5 other individuals, and then Marcia to guide us, because I might have an idea about how it could be carried out, but then there's 5 other people who are like, well, what about this? And what about that? And so it was a lot of group discussions. It was a lot of us coming together and a lot of talking, but that was the great part of it. It was great to hear other people's thoughts and ideas and things that I never would have thought of. Marcia had been through the PACER program, but she also works with Dr. Castillo in terms of kind of CMV and cCMV research as well. So it was really lovely. I don't think our team would have been quite as on track as we were if we didn't have Marcia's guidance. So lots of conversations. We decided to offer focus groups and individual interviews with participants. I think we held 2 focus groups, and then we had several individual interviews where all of us on the team, all 6 of us, got to be part of focus groups and then also individual interviews. We did a lot of advertising all throughout Canada, which was really interesting. Our team is from Alberta, but me from Ontario, and Carolyn from Quebec, but also she was living in the States at some point. So, but it was great. It was really interesting to try to reach, participants all across Canada. So we did a lot of social media advertising. We did CMV Canada helped us with advertising. I don't know if Marcia, you want to jump in?
Thanks, Laija. It was a pleasure being a team support for this team. I learned a lot from them as well. Each PACER cohort has a team support working with them. So there's an instructor kind of instructing the course, and then there's team supports that support either one or multiple teams, depending on how the course is structured. And I got to work with the CMV team, and I helped recruit them. And it was just a brilliant group working together. And I really loved my time with you guys as well. So thank you, Laija. Yeah, we also recruited through Abs for You. Yeah, so there CMV Canada, Abs for You, and then our own sort of personal networks of CMV families.
Yeah, and I think we were able to get 12 participants kind of scattered across Canada. And I think what was interesting, I feel, about our group is that we also had some not just maternal perspectives, but also paternal as well, which I thought was really great to kind of have some dads in there too and hear what they experienced and thought and their perspectives were. So that was a great part of I felt of the project too.
Can you share some themes that emerged from your data? What were some of the key themes? What did you learn from some of this from your work?
Yeah, absolutely. It was a lot of work because for the interviews and for the focus groups we transcribed everything and then for individual interviews we did thematic analysis there too. But we had three main themes that kind of stuck out to us, and we all did it collaboratively on several occasions. It's definitely a lot of work. And the three themes were attitudes about screening, CMV diagnosis, and I think interestingly, the third theme that we came across was awareness. And so our research question was really wanting to understand parental perspectives on CMV screening at birth, universal CMV screening at birth, because Dr. Castillo had brought up that there's a lot of from the medical perspective side, anxiety that can come with a potential diagnosis that at birth that maybe may not lead to any type of health or developmental impacts. But what do the parents think of that? And especially from a Canadian perspective as well, because we have Ontario that screens for cCMV at birth. And then Saskatchewan followed suit just recently. I think Ontario was 2019, Saskatchewan was 2020 or 2021. And I think, is there two other provinces, I believe, Manitoba and Alberta? Yeah, that they're kind of that's in their works, and I think they're going to be implementing universal newborn screening for cCMV at birth as well. So that's really interesting. So we wanted to see, do parents support it? Are they worried about it? How do they feel about it? Especially if they have experience with CMV, would they want to know? Would they not want to know? Again, I think that for Carolyn and myself, we would have wanted to know, but not about us, right? So the third theme was awareness, and that was not something that necessarily had to do with our research question, but it was something that was blaringly obvious that came across every single interview and our focus groups that parents want to know about CMV, just in general for the general population while they're pregnant, part of their maternal care, and even after as well. So that was something that we included because we felt it was really important. So, overall, the first theme, the attitudes about screening, there was unanimous support for screening. Participant statements that universal newborn screening for CMV should be included nationally. And one other key sub-theme that came up, that anxiety was not a deterrent. So a lot of the participants said that they're going to have anxiety no matter what, but that they want to know if their child has cCMV so they can better support them and get early supports and for themselves as well. And then the second theme, the CMV diagnosis, that kind of, there was three sub-themes, and that was quick access to medical follow-up post-diagnosis so that their children can get those early supports that they need that would hopefully prevent, delays, such as I experienced with my son with getting his cochlear implants much later. That they really would like supports and resources as well. It's one thing to get diagnosed, but it's also another thing to feel like you're supported and you have a lot of resources to help you, because as we've been talking about, cCMV and CMV is not really well known. And a third kind of sub-theme of the CMV diagnosis was that medical professional communication was really important to them. So how it was relayed to them, the way in which it was relayed to them, and having felt support from their medical professionals was really important. And I already talked about the third theme of awareness, but that was something that was really, really jumped out that I don't know if I want to say we didn't expect it, but for myself anyways, I didn't expect that it was going to come across to be so important to everyone. in all of our individual interviews and our focus groups.
So you spoke about some of these themes that came up. Were there any patient recommendations or like those final results that came from the study, and how are you going to do this, or what would they like to see done? You have these themes and then sort of that now what?
Yeah, so part of the PACER program has that set, collect, and reflect. It's kind of 3 steps. And so the last part is reflect. And so we brought everyone back together to talk about our themes and see how they felt about them, make sure they were accurate, if they had any recommendations. And I think, correct me if I'm wrong, but I'm pretty sure we had about 3 recommendations that really, 3? Yeah, okay, that were highlighted to us, and that universal newborn screening for cCMV should be implemented nationally across Canada. That was unanimous. That was very obvious for us in all of our interviews and focus groups. Medical professionals should provide coordinated and comprehensive resources and support at the time of the diagnosis, with established protocols and processes to promote ease of access and support positive diagnosis. That was something that was really, really apparent because, like I had mentioned, getting the diagnosis is one thing, but it's a whole spectrum, and you can feel quite lost and without direction and support and guidance and input. And not just information, but like credible information. Don't just go and Google it, because it's a scary place, as we all know. Google can be a slippery slope. So having the medical professionals provide coordinated and comprehensive resources and support was really important as a recommendation. And then the third one was raising awareness about CMV and cCMV should be Canada-wide. It should be a priority, and every pregnant person should know what CMV and cCMV is and how to avoid contracting the virus during your pregnancy. That was another recommendation that we found.
I just want to add a little something because what was very interesting about our findings with that research is that, like, our question was going towards like the screening, the newborn screening for CMV, and during the PACER process, the set, collect, and reflect, the participants were challenging us with awareness. We have to spread awareness, but the gap in the literature was that we needed those data for, like, there was the missing part about the screening and the parents' perspective and like all that medical side of things that we don't want to stress people about it. So let's not talk about it. So I find that it was very challenging as a parent because we know awareness, that's what we want. But the literature showed us that the gap was data on this newborn screening. And at the end of everything, our research, awareness was one of the main themes. So it was a very interesting process because we knew the awareness was our main goal, and for everybody in the CMV community, we wanted to be put on the map and that everybody knows about CMV. And doing research, finding literature, finding the gap, and at the end, awareness is one of the main themes, was very exciting because how can how can you spread the word more than with literature? We came with results that is showing that awareness might be a very good way of talking about CMV and to get those newborn screening accepted in all Canada and worldwide. So that's just a little thing that I wanted to add.
Yeah, well, you set up my next question like just perfectly. So circling back to Dr. Castillo, you were speaking about this very topic earlier about how clinicians thought that it would be better not to test and kind of like scare parents or worry parents, or, that they don't want to know. Since the completion of this study, have you had the chance to educate or have conversations with clinicians or share this work with colleagues. What have those discussions look like, and what kind of response are you getting?
Thank you, Sandra. This work is a catalyst for more work because there is a lot to do. So number one, from the provider perspective, and having written the guidelines, there is actually some work, and some there is a desire, I should say, to actually do something about implementation of guidelines. That is not about knowledge, but it's actually about doing. This piece on awareness, which came up loud and clear from the PACER study, is very important because it really prompted us to take a step to work with providers and patient partners to determine what do providers need to have these conversations, right? There are so many competing priorities in healthcare. Perinatal care providers are supposed to go over 400 things. And one thing that when we have shared these findings with providers, one very important thing that providers have told us is it has to come from the patient. And then what I would like you, Eliana, and in your and with your research team, is also to help us be ready for the patients, right? Have the resources and the training and to address what the patients, but for this tension, between how things come top down or from the ground up, is maybe is maybe too simple to think about it, but that way. But on the other hand, providers have really told us loud and clear, I need patients to come and ask me about it, which goes to the work doesn't necessarily have to happen only in pregnancy, that actually there needs to be more of that awareness happening even before and then. So specific things that this study has given us the sparkle to do some digital work, where we have asked parents to tell their providers, or to ask the providers, why, like, you told me about wonderful things. You told me about the prenatal vitamin. You told me about the cat litter. You told me. Why didn't you tell me about CMV? And using that as a way to also understand, what do you need to have those conversations? And then understanding kind of those barriers and facilitators from a provider's perspective. But I have to say, there have been venues and instances, for example, with the people that do a lot of the continuing medical education for providers, where we have heard loud and clear, if you ask if you ask people who actually have the lived experience, of course they're going to tell you that they want to hear and they want to know about this, of course. But what about the parents that are going to suffer, are agonize? The 80% of parents are going to agonize, knowing that their kid has this infection, but nothing may happen to their kids. So I think we also need to document that voice and to document what other parents have told us that is, and some parents in the PACER study actually told us is, I want to know, and then I decide what I do. Don't make the decision for me.
Sort of that paternalistic approach to care, where not trusting that people can handle the education, because it is like, I think there's an approach to how you educate people too, and it's not necessarily to scare, but it's to bring awareness. So, back to that theme and recommendation around the awareness, so that you can eventually make an informed decision if you're crossing that road. Maybe this is a good time to ask if any of you have had the opportunity to share this work.
Well, I was going to introduce Laija with that because, well, I can speak, but you can speak as well. But Laija worked on the manuscript, I think, for publication, which it's a pretty big deal, I think, for our study. And once it's published, if it's going to get published at one point. I think it's going to be pretty solid for us to just continue the work and continue to talk because it's in the data now and published. So it's kind of a big deal, I think, and it's pretty exciting as a parent and as a researcher now, like be able, and Laija, thanks so much for all the work you've done with our research. We did a lot of work together, but the main work was done by Laija with her background in research and her lived experience.
Thank you, Carolyn. That's very nice of you. Yeah, so the manuscript is very exciting, but I also feel it's very important to mention again Marcia because she helped me a lot with that. I kind of took our final paper for the PACER program and used that as a template for the manuscript to kind of edit. But I think that was a very much it was me doing that, but it was also a team effort. I mean, Marcia has lots of experience with submitting manuscripts, so lots of the formatting was her. And we had all our team members that commented and made edits and suggestions, and Dr. Castillo was also part of that as well. So I still feel like that was a big team effort, I think, on all of our ends. And also part of that, we also presented our PACER research poster at the CMV Public Health and Policy Conference in Utah in 2023. I had to think about that for a second. But Marcia was there, and also during that conference, myself and Marcia kind of went around and tried to tell people about the project and if they could participate, if they were eligible. And so that was a little bit of kind of recruiting or advertising there too. But there's also a lot of conferences, I'll hand this off to Marcia, but that the PACER poster has been shared at as well. So it wasn't just the manuscript and the CMV Public Health and Policy Conference. Marcia has done a lot with trying to talk about this project and gain awareness of it too.
Well, that's okay. I actually had forgotten about that conference, Laija. That was way back. I think we were just sort of presenting our set results at that conference to say, hey, we're doing this work. And I forgot about that. That's awesome. And then yeah, since then, honestly, it's been fabulous. The whole team has been out doing knowledge translation, right? Barb and Rabia presented, Ikmat has presented. Like it feels like we've had multiple posters and multiple oral presentations, and even an oral presentation that was selected. I think actually twice we've been selected for a highlight oral presentation. So people are interested in this work, and I think they can see what a great job this team did on their methods and collecting the data. Like when you and just how articulate the team is. I think they just do a really great job of articulating their findings and being so passionate about it. And I think we haven't really talked about it so much, but Laija and Caroline were the two that had lived experience on the team specifically with CMV. But we created 4 more CMV champions in our CMV team. So they came, I think, we talked about they came with other lived experiences of motherhood and challenges with family members and things like that. So they had related lived experience, but none of them knew what CMV was when we recruited them for the study. And I think any one of them could stand up at a podium and give a very inspirational CMV talk and really advocate for CMV. So that's kind of another neat outcome of this project and the knowledge translation and the number of places we share it at. I think every time we share it at a conference, we create just a little bit more awareness in terms of that third recommendation. So it's really exciting.
Yeah, is there more work that's coming from this? What's next for everyone?
So what's next for me? Carolyn's speaking right now. So what's next for me? So I have a lot of excitement about continuing being partner in other research, and a couple of research team communicated with me to be part of certain projects that were on the water or like going on. And all the knowledge I got from being in that PACER program and with conducting that study and with that whole team that we've been talking with during that podcast and all our research team as well, it's just like it gives you confidence and gives you credibility in a field or in a virus that is not known as much as we wanted to. And so I feel pretty confident with a future project with CMV Canada and being a referral for our other CMV families. And I've been able to work with all the doctors from St. Justin as well. So it's kind of a big community. And what I just want to highlight here is that even when we go in those conferences, CMV conferences with all the doctors, the researchers, and us as parents, and now parent partners, um, the community, it's not because you're a doctor and you're a researcher that the voice of the parents is lower. We're all in the same boat, and uh like I don't know the word. Maybe you can help me, guys, but
Power
there's no
differential.
one, yeah, so there's no one higher than the other one. Everything that is said and discussed is nourishing the 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 interest of continuing spreading the words, talk about awareness, talk about CMV, and be involved in the medical and research community. Even before the PACER, like they wanted us to talk about it as a parent. And now being a PACER graduate, it's just give me the power to be like, oh, I know my subject now, and I know I wish to continue working in that field in the future. Yeah.
Okay, so Dr. Castillo, is there what's next for you? And do you want to share some maybe key learnings from your perspective of what it was like working with this PACER team?
I think the number one is the power of being an expert in, an expert with life experience, and how that knowledge is actually is so much actually of what we need to do. The process is so much of what we need to do, now that we are in that everyone is into the colonizing academia. How are we going to do it if we don't partner with the people that are the real experts on what's going on, right? So that was a very, very a very concrete learning for me, to just to see that there is a way forward for change, and that not everything is lost sometimes when we hit the wall over and over again about trying to affect change. So that was probably the biggest learning. The second learning is that, like, in terms of methods, you can learn methods, you can read about methods in a book, in a paper, you can reach out to experts on methods, but you cannot learn experience. Only in the University of Life, Laija or Lisa or Caroline or Marcia, only the University of Life could have taught them what they can teach us. And next for me, I guess I'm going to be working until the day I die, because there is so much to do. But for us, this has been big to partner, and actually that is something we're working on in a partnership, to do a lot of community engagement and community awareness on CMV in general. And then we are right now, and we have actually a study underway where we are using kind of theory of how people change their behavior to facilitate how a practitioner can be ready for when Leah or Caroline or Lisa come their way with CMV questions, and empower that clinician to actually say that we don't know, but that they will look it up, or that they will get back and we'll talk about it the next consult.
Lisa, did you want to share just a few words?
What I just wanted to say was, living in the province of Alberta, our government has announced funding for universal screening for universal newborn screening for CMV. So that's coming in the future. And I think what I've realized is how important it is for us as people with lived experience, as family members of children with CMV, to participate in the process to make that as successful as it can be. Because it's a really complex process to diagnose every baby born with CMV and then make sure that families, no matter where they live in the province, get equitable access to all the different types of follow-up and care that they may need. So I'm really excited about that announcement, and also very realistic about how much work needs to be done. And I think as patients, it's really exciting that we can engage in that work and make sure that families can have the best outcomes possible. And I think that really connects back, and I'm really inspired and empowered by everyone who participated in the PACER study, just to be reminded how important the voices of patients are as we make progress and things get done. I think that's still really important for patients to be part of that.
Yeah, thanks so much, Lisa. And then Laija, would you like to close us off with some final key insights that you'd like to share with the audience, and maybe what you're working on now or what's next for you?
Yeah, so just like Carolyn, I think that being part of the PACER program and being involved in any type of research and going to those conferences, you make these great connections with people that you don't even know or could even possibly think that you would make a connection with. And from there, great conversations happen and you get to learn about each other. And there's lots of opportunities that come up for you to participate as a patient researcher on their teams and with projects that they're working on, or participate as participants as well. So I have a few other projects that I'm involved in. Some are dealing with maternal health, but some are specific to CMV. So that's exciting. I'm happy. This is my experience with the PACER program and with my master's research has really, I guess it's really given me insight into how valuable research is and how valuable and important it is to put literature out there for any type of knowledge translation, but also for, like I said, social and structural change to happen. And even more so, how it's important to have it from those people who have lived experience from their perspectives, like I said, because they are, they're the people who have all the knowledge. They're the ones who are experts at their lives and what they've been through with it. And they're important, and their words and their experiences are really valuable. So I'm really looking forward to doing more of that and being involved with more research. And then, of course, that brings me to my PhD in health sciences. I'm really excited about that. I'm going to take my master's research as the beginning step and kind of go off of what I've learned with that and hopefully make some more social and structural change here in my area, but maybe potentially bigger as well. So it's a 4-year program, so I have a lot more to do, but I'm really looking forward to it. I feel very fortunate and privileged to be where I am, to be able to do this school, be going into a PhD, and be part of the PACER program. So yeah, I think my key takeaway from all of this is I've learned a lot. I've valued my connections. It's important to go out there and make those connections, even though sometimes it can be uncomfortable or scary. But that they can lead you to a lot of wonderful things, and that research is really important, and I'm this is all I want my life to be. So I just feel really privileged and lucky to be here with everyone.
I just want to say thank you to everybody that is here today. Like, thanks, Sandra, for allowing us to speak and to voice and to spread our work and the importance of PACER and the importance of patient partners. And I also want to thank Eliana for trusting in us and trusting in us patients, and Lisa as well. Like, all the knowledge you guys have with CMV and even with the provinces and those papers and those governments. I want to thank Marcia as well, because without you, we wouldn't have been able to do such an amazing work with that study. Thanks for Laija, of course, and Sarah, Barb, Ikmat, and Rabia.
Thanks so much for joining us for this episode of Pep Talks, the Patient Engagement Podcast, brought to you by the Alberta Strategy for Patient-Oriented Research Patient Engagement Team. Make sure to subscribe to this podcast wherever you found it, and we hope you'll join us again for more interesting discussions about patient engagement in health research and healthcare.